We are in the year 2023. Just 3 years ago, we were in the middle of the biggest lockdown in our nation's history. The COVID pandemic was brutal on us, both mentally and physically. But it had also opened our eyes. The pandemic had revealed and exacerbated the flaws in our healthcare system. It had implored us to rethink the way we look at healthcare in India. According to the WHO, India is affected by a rising wave of premature deaths caused due to non-communicable diseases. And these deaths account for over 60% of all the deaths in India. Having said that, is there a way all of this could have been prevented? Is there a way the situation could have been made a little better? The answer is yes. And one of the solutions to this problem is by providing the citizens a constitutionally guaranteed right to health. In the list of human rights accorded to our nation's citizens, the right to health has grown in importance. All of the world's major organizations, including the WHO, the OHCHR, recognize the importance of a right to health. And many countries leading in terms of healthcare also provide to their citizens a constitutionally guaranteed right to health. But what does it mean to have a right to health? How can we ensure that everyone enjoys these rights without any discrimination? And what are the challenges which we'll face while achieving this goal? These were some of the questions which I wanted to answer during my own research on this topic. And through this talk today, I will share with all of you some of my findings and some of my insights which will help us advance this right for all of us. Let us start with an analogy. Consider a player in a multiplayer Fortnite-style game. Now, in this game, you have to engage in a virtual battle royale with many players from across the world. Now, as you continue playing the game, the health of your character slowly depletes. And after some time, the health of your character will be so low that it will be clinging to its life. And you, on the other hand, will be doing all in your power to win a round or win a fight. At certain times like these, the game itself will provide you something akin to health potions or crates which are full of supplies. And consuming the contents of these crates or health potion will help you regain your health. Now consider this situation as an analogy for the 3.2 crore Indians who live below the national poverty line each year, just because they spend most of their money on health. Right now, over a staggering 70% of all the healthcare costs are covered by the patients in the form of out-of-pocket expenditures without any help from the government. And just like the player in a game, the Indian citizens are in desperate need of help. And this help will be provided to them by the government. And considering the fact that the increasing cost of healthcare in India is one of the main reasons for the rising levels of poverty, this trend needs to be reversed immediately. One of the reasons why healthcare is becoming so expensive and exclusive in India is because the Constitution does not recognize right to health as a fundamental right. Although, according to the Article 47 of the Directive Principles of State Policy, it is the government's responsibility to improve the public health care. But then again, these directives are not enforceable in any court of law and are just declarations. Yes, the Supreme Court of India, in some of its decisions, has averred time and again that the Article 21 constitutes right to health. But then again, these judgments have had minimal impact on the healthcare system of our country. And the implementation, the most important part, is still a far cry. Now, countries which topped the Bloomberg Health Index in 2019, like Spain and Italy, spend considerably more on healthcare than what India does. Both of these countries spend around 9 to 10% of their GDPs on healthcare, whereas India only spends around 2.2% of its GDP on health. Both of these countries have a robust compensation system. This system incentivizes the private sector to provide robust and top-notch healthcare to the citizens because they're assured of a prompt compensation by the government. Moreover, several organizations are involved in pharmaceutical product quality inspections in both of these countries, ensuring that the technology which is used in healthcare stays up to date. India can take a leaf out of the healthcare models of both of these countries, and it can create an infallible and an unerring mechanism of efficacious rules to ensure that the healthcare of its citizens remain top notch. But during my research, I came across various reasons as to why healthcare, right to health, is not a reality in India. And these reasons varied from insufficient public budget to lack of political priorities or just simple indifference of the political elite towards a matter as important as health. One of the main reasons which I came across was that since healthcare is a part of the state list of the constitution, only the state governments can form rules on healthcare. One of the solutions, according to me, to this problem is simply moving the matter of healthcare from the state list and putting it in the concurrent list. This will ensure that both the state governments and the central governments can collaborate, share their best practices, and address any funding related issues. This move will ensure a seamless transition of a nationwide right to health in India. The current healthcare industry of India, if not broken, is like a gossamer thread. Another medical crisis, even of the slightest degree, can jeopardize the whole medical healthcare industry of our country. We need to move towards an era of disease prevention and personalized medication. We need to ensure that the right to health is guaranteed to all the citizens without any discrimination on the basis of caste, creed, religion, sex, or any other condition which can induce discrimination. In India as well, some steps have been made in the right direction. In 2023, Rajasthan became the first Indian state to provide a constitutionally guaranteed right to health to its citizens. Although a step in the right direction, it had faced a lot of backlash from the Medical Association of Rajasthan. Some of the concerns of the associations were addressed by the government, and we hope that many more will be addressed once the rules of the law are formed by the legislature. Now, I will ask all of you to just humor me for one last time. Coming back to the analogy of a fortnight friend, what happens when he consumes his specially concocted health potion? Well, as we guessed, the health of the character slowly increases and he goes on to win a previously losing battle. Now, taking this situation again as an analogy, improving the healthcare of our country will not only improve the physical and mental well-being of the citizens, it will also help us in our economic advancement, help us in our battle of becoming a developed nation. The time is now for our government to be the saviors of the population. The government needs to invest and expand the public healthcare system of our country and make sure that universal health coverage becomes a reality in India. We, the youth of the country, are the future leaders, the future changemakers. We need to ensure that a right to health becomes a reality in our country for us and for our coming generations. With the right to health, we will have the power to shape a future we want for ourselves. The right to health is our right. It has to be made our responsibility. Thank you.